San Francisco city leaders are pushing for supervised injection sites, all in an effort to reduce the number of people dying on city streets from overdoses. KTVU's Christian Captain talked with the supervisors pushing for those sites. And Christian, like before here, this is facing some legal obstacles.
Yeah, Mike, it's facing those legal obstacles on the state and federal level, but some of the Board of Supervisors members say that there are people dying on the streets of San Francisco every day. They say that's why they simply cannot wait, so they are pushing to try to create those wellness hubs immediately. Evidence of San Francisco's drug crisis is easy to spot. Lawmakers in the city say the crisis has already killed too many.
We've lost over 1,900 San Franciscans since 2020. 1,900 San Franciscans. That is like 10 times the amount of San Franciscans we lost during the COVID crisis.
San Francisco had been moving toward opening supervised injection sites for close to a year. Just this month, the city shut down the Tenderloin Linkage Center and so far has not opened an option. Supervisor Hillary Ronen has proposed hearings on why progress is stalled and is calling for $5.5 million to fund the opening of wellness centers in some of the city's hardest hit neighborhoods.
Safe consumption is just the beginning of that tier of services. It's the place that people go before they see a way out of their addiction.
Lydia Branson from the Gubbio Project, helping treat those struggling with addiction, says until last week, she had been working with the city towards setting up a wellness hub.
While we were in this process, all of a sudden it was, we're not going to continue the process. There is no longer a way forward. These funds, these sites will not be funded.
Mayor London Breed says she supports the idea of opening supervised use sites and says the obstacles aren't financial, but legal. She says she's looking for guidance from the Department of Justice.
Again, these are difficult situations because this involves legal advice, significant criminal liability, which we cannot just ignore.
Supervisor Ronen says at least 7 board members support the wellness hubs, enough, she says, for a veto-proof majority.
It is time to step up, take leadership, have some courage to stand by scientifically proven interventions.
San Francisco's city attorney has said his office supports a plan similar to what's happening in New York, where consumption sites are operated by nonprofits. City funds could be used for treatment and health programs, but would not directly fund safe consumption sites. We're live in San Francisco. Christian Captain, KTVU, Fox 2.